Hello, welcome back guys. This is a very interesting topic today on management of a collapsed child or infant. So I'm just getting ready with the emergency equipment that I might need to use. My greatest appreciation goes to Clinton Health Initiative for this program on pediatric emergencies, that is ETAT Plus, meaning emergencies, triage, assessment and treatment, using the ABC approach, airway, breathing and circulation approach. And I felt I should use my YouTube channel to reach these very important information to as many medics as I can. Thanks Chai for making me one of your trainers on ETAT. So in this video you will realize that I'm not going to use adrenaline because you only consider giving drugs if there is a third party. So don't stop doing the resuscitation and start rushing for the adrenaline. A good resuscitation should give you good results. So guys, I'm going to give myself a scenario. I'm going to review a 7-month-old baby who the mother reports that the baby has stopped breathing. So what should I do? I'm going to consider the 4 S's. The first S is safety. Is the area safe for my patient? Are there any sharps around? Is the area decontaminated? Then my own safety, whereby I wash my hands or I sanitize. Then I glove. Then the second S is stimulation. I approach the baby as I observe. Then I ask the mother to call the child by the name since they know the mother's voice. The baby isn't opening the eyes, so I will try make some noise by clapping. The baby doesn't respond. In this case, I need to shout for help, help, help. Then I change the setting to my resuscitation area. I'll begin my assessment with the airway, look into the mouth. So I see some secretions. I'm going to do the suctioning, only what I can see, starting with the mouth to the nose, only what I can see. Then once the mouth is clear, I can position the airway to create patency using the hand tilt, chin lift maneuver, hand tilt, chin lift maneuver to sniffing position. Then I proceed to be breathing. So I look, listen and feel. Look for chest rise, feel for warm air on my cheek and listen for any breath sounds. So I'm going to do this for 5 seconds using a 2-syllable word. So my baby is not breathing. My helper has not yet arrived. So I need to give my baby 5 rescue breaths. So before that, let me size my mask. The correct size of a mask should be from the nose bridge to the chin, not past the chin, not too small, and not covering the eyes. So this is the correct size for my baby. I'm going to fix the mask on my BVM. Then give the 5 rescue breaths using the CE grip. C, that is the thumb, and my first finger will give firmity to the mask. Then the other 3 fingers will align on the jawbone. Ensure that the fingers are not pressing on the soft tissues. The E maintains that sniffing position. When giving the breaths, ensure that the chest is rising. 1, 2, 3, 4, 5. I'm now going to proceed to see circulation. I'm going to take the large pulse, that is the brachial pulse, since my baby was 7 months old. Over 1 year, you take the carotid pulse. So I'm going to do this for 10 seconds. So there is no pulse. Lucky enough, my helper has arrived. Any baby with no pulse or pulse less than 60, do CPR. I'll give her instruction on how to do the CPR. So the landmark should be 1 finger breadth above the sternum, that mid-row area. Then engulf the baby with your 2 arms. Then the depth for the CPR should be 1/3 of the AP diameter. So you are going to give 15 chest compressions as I give 2 ventilations. On your BVM, there is a port where you can fix your oxygen while still doing the resuscitation. So we are going to do this for 2 to 3 minutes, then reassess to see if our baby has improved. These will be about 6 to 7 cycles of the 15 chest compressions and the 2 ventilations. You will notice that when I'm giving the 2 breaths, she's lifting her thumbs so that we can see the chest rise. Two minutes are over. Let's reassess, starting with the airway. Any secretion, you suck it out. Then you position into sniffing position. Breathing and circulation together. Our pulse is at 40. Our respiration is at 12. We need to continue with the resuscitation at the same rate. 15 chest compressions and 2 ventilations for another 2 minutes. Two minutes are over. We reassess again, starting with the airway. If there is still any secretion, you suck. You position, sniffing position. Breathing and circulation, you do them together. This time our pulse is at 100 and our respiration at 35. That's nice. So we start on oxygen to support the baby. Then remember to keep on reassessing your baby to see if they are improving. So what if during the reassessment our pulse was at 100 and our respiration at 8 breaths per minute? So our pulse rate is above 60. So we don't need to do the CPR. We just need to continue the ventilation at 30 breaths per minute. Ensure that the positioning is correct. Use the CE grip so that you can get a chest rise. So we are going to give 30 breaths in a minute. Then reassess, starting in the airway again. Suck if there is any secretion, position. Then assess the breathing and the circulation. So at this time, our pulse is 120, our respiration is at 40 per minute. So it's good. So support your baby with oxygen and remember to keep on reassessing. If you have liked this video, give it a thumbs up, guys. And remember to subscribe. It's free, guys. Goodbye.